Good morning, good afternoon, and good evening, colleagues and distinguished guests who are joining us today here in Bangladesh. Assalamu alaikum, and those joining us online. Thank you for joining us in this fourth day of the Global School of Migration and Refugee Health. Today's topic will be the pivotal role of universities in building competence for refugee and migrant health. Today, we will look into the important role those the universities and academic institutions play in research, in addresses the knowledge gap, emergency trends, and the country priorities for addressing migrant health. Furthermore, we need to ensure that the research translates into policy and implementation. But without further ado, I will introduce our colleague and director, Dr. Santino Severoni, director of the International Global School as well in the program of health. Please.
Thank you, George. Thank you so much. Well, welcome again. Today we are day 4. Our journey is continuing. We started with a capacity building on health systems, follow on gender human rights, a very technical day was, then the cultural competency, again, very stimulating day. And after cultural competency, we could not go elsewhere that into discussion on research. Research is really one of our key priority area of action for the WHO Global Program on Health and Migration, for a very simple reason that the topic of health and migration in many extent is still a new topic for the health sector. Not in all countries, health sector is a protagonist together with other sectors. We do understand the topic is by nature multi-sectorial, cross-cutting, and this is might be realizing into a challenge for all the possible interested party to join around the table where policies are discussed, where services are designed, or even budget is allocated for action. So research is very important because we should be able to really keep the pace of providing all the evidence possible, all the most reliable data possible. And in the global program, we are exactly in the middle of the process. We already conduct a consultation, and more are coming with different parts of the civil society, international organizations, to shape up a global research agenda with the hope that the global research agenda will be an inspiring tool, a supporting tool, or a tool for cooperation with all regions. We are particularly looking to those regions where we can eventually identify and establish collaboration with new academic institutions. So I'm stopping here, not to take more time to the upcoming key note presentations, high-level speaking, and video reportage also today, very interesting one from 2 completely different contexts. I'm not going to preempt the content to keep your attention high. Welcome again, and back to you, Jorge.
Before we proceed, at the end of the presentations, with your evaluation is important for us, your inputs. Furthermore, all the recordings and presentation will be available for all the participants for you to have access. Lastly, but not least, in the Q&A that you will get at the presentation, please try to write your questions as you go. So that way we proceed those queries and doesn't get all loaded at the same time. Please, if we don't have time for all your questions, be aware that we will reply that electronically back to you. So now we go on further. We would like to first thank you, Dr. Severoni, for introduction, and I would like to bring over Dr. Rajat Khosla, the director of the United Nations University International Institute for Global Health, for his high-level address. Please, colleagues.
Greetings, colleagues. It gives me great pleasure to join you today as part of the third Global School on Refugee and Migrant Health. The United Nations University is a global think tank and postgraduate teaching organization headquartered in Japan. The mission of United Nations University is to contribute through collaborative research and education to efforts to resolve the pressing global problems of human survival, development, and welfare that are of concern to the United Nations, its people, and member states. In carrying out this mission, the United Nations University works with leading universities and research institutions in the member states, functioning as a bridge between the international academic community and the United Nations systems. Through postgraduate teaching activities, the United Nations University contributes to the capacity building, particularly in developing countries. The United Nations University International Institute for Global Health, based in Kuala Lumpur, Malaysia, is the designated UN think tank on global health, servicing as a policy translation hub for United Nations member states, agencies, and programs. It was established by a statute adopted by the Council of United Nations University in December 2005. Our institute generates policy-relevant analysis by applying a gender lens to inform the development, implementation, and evaluation of health programs. The institute also supports capacity development of local decision makers and stakeholders to engage effectively with global health challenges within the 2030 Agenda for Sustainable Development. Colleagues, universities can play a pivotal role for promoting competencies to properly address refugee and migrant health needs and rights. This would require reimagining whom they teach in terms of students, how they teach with regards to teaching techniques, and what they teach in terms of curricula. Universities must identify ways to ensure that refugee and migrant students are able to register and enroll in educational programs offered by their institutions. That enrollment procedures are developed keeping in mind that for many of those belonging to these populations, it is often may not be possible to provide the same kind of documentation and other requirements. This has implications also for fee structures, which often disincentivize the ability of refugee and migrant students to enroll in programs of their choice. Critically, universities have to reimagine the teaching techniques, that is, both the hardware and the software of how they teach. Teaching programs have to cater to the differential techniques and learning methods that would cater to the needs of refugee and migrant students. Lastly, universities can play a critical role by reimagining what they teach by ensuring that the curricula they develop speaks to the health needs and rights of refugees and migrants. For refugees and migrants, we have to look not only at the interplay between in-country health policies and those between source, sending, and receiving countries. In particular, global health programs should pay attention to issues related to laws and regulations and protections available for refugees and migrants, issues related to environmental health and mental health, trauma from physical sickness, loss of property and family loss, of cultural identity, of place in migration, and loss of livelihood that affects overall health being of refugees and migrants must form part of the curriculums as well on global health. Colleagues, dear friends, universities can play a pivotal role in building competencies for refugee and migrant health. For this to happen, we need to ensure an integrated approach to global health, one which places health and human rights of refugees and migrants at its core. Thank you.
Thank you to Dr. Raja Kozlak. By the way, it should be noted that I had more than 20 years experience in research, especially focused in inequities in migration. It should be also that we should note that clearly he stated how our universities is an important role in the research on what we practice. For example, it's not only who will train, what are we trained, what curricula and what methodologies to be used. In the addressing the migration health, we need to consider not only the health aspect, but we need to have also socioeconomic and environment, culture, which is beyond health. So it should be a multi-sectoral approach. As we go further, we're going to continue now with two different reportages that we see in the second sections. There will be two cases. The first cases will be from the European region, the WHO European region is in Sweden. The second case will be from the American University in Beirut. In between we will have the keynote to speak. Now we go proceed with the first case from the University of Uppsala in Sweden. Please, colleagues.
Sweden has been both a country of immigration, people moving out of Sweden, but also a country of people coming in. Until Second World War, for instance, the mid-1800s, we have had people actually moving out, mainly due to poverty and other kinds of reasons. Since the World War, since the 1930s, people start to come in, both for work-related reasons, because Swedish industry was booming, we needed more workforce, but then we also took in a lot of forced migrants in terms of refugees and asylum seekers. From Chile, for example, then the 90s from the Balkans, and then Iraq, Somalia, and so on. And now recently, forced migrants from Ukraine. During the period 2014 to 2016, Sweden was one of the largest recipients, one among the top 5 recipients of asylum applications in the world. So a large majority of the migrants that come into Sweden right now are labor migrants to work in the automobile industry, to work in the IT industry, for example, from countries like India. All this results in the fact that around 20% of the current Swedish population are foreign born. Refugees and migrants have more or less full access to care, but then there are also certain groups where the access are limited due to legal reasons, but also due to language barriers and a lot of other factors. Having that rich migrant history makes Sweden a unique position in providing education and training in migration and health.
A university is pretty much occupied with research and education, but that's not the only task that we have. We actually have to make sure that the research results that we have are implemented in clinical care, for instance, or translated into practice. And having workshops or courses or providing education is a very good way for us to make sure that whatever research we come up with can actually be used in clinical care or in society.
I deal with migrants, health and ethics every day. So when I found this course, I was very glad because I think that could really help me to get a better understanding and help the people I meet in a better way to give them better care. So this course was kind of perfect for me.
Currently, I'm working at the Swedish Public Employment Service, and my main role is assisting newly arrived immigrants to Sweden to help them to come into the Swedish labor market. The course has contributed in my better understanding that migrants' health is affected during migration. During the course, we have discussed and covered the various definitions of migrants, the migratory journey, and the challenges it entails. We have also discussed about how belonging to a particular group and also taking a particular journey can entail in additional health challenges. And all this knowledge will help me in understanding and also in seeing migrants that I meet in work-related situation to see them from a holistic perspective.
The idea of the course is not to actually tell them how to treat a particular disease. It's not that specific. Rather, what we try to discuss is the public health perspective on refugee and migrant health, and how ethics and human rights and other aspects cut across this spectrum, and how that actually influences health. What we will discuss today is actually social determinants of health, or rather migration as a social determinant of health. So hopefully with this course they will develop a much more holistic view of migrant health, and when they have a client who is a migrant in front of them, they not only see that individual but also understand the wider context where he or she might have come from and the long or short journey that individual might have taken. This will give them that bigger view.
I think the most important thing the course brought with me is my view of seeing the world is not the only one that we could see from different angles and different. To be curious about that. When I took the course during that period, I changed job actually by then, so I worked as a child health care nurse. So then I met a lot of women from Eritrea, and they were all with newborn children, and they were all kind of hard to reach. And came up often to me and asked questions about the child and had hard time connecting to the child. And then also at the course you get reminded of the travel route they have been through, and all of them have passed through Libya. And then we had discussed in the course how it could be to be in Libya for a refugee. And then I was able to ask them about the route and how they ended up in Sweden. And they all started to talk about a very traumatic experience. And then I could slowly start to help them to get some help for the traumatic experience and give more patient and more time and gain trust. So the child started, and they could connect more to the child little by little. Since I was working a daytime job, it was very good that it was evening time, and also that it was stretched through a whole semester. So the work wasn't that intense, that the courses tend to be in maybe 5 weeks, you should go through a lot. But now it was a whole semester, so you had got time to reflect and do a little by little. And evening time was also very good.
There is a quite strong move now to make courses more easily accessible by making modules or MOOCs, stuff like that, that are more open courses where you don't need to go actually through the university with applications and so on. You just register to a course or a lecture. That's a way to open up, and that is also something that is asked for by, for instance, people working at hospitals. They need to develop their skills and knowledge, update their knowledge. So there is a need for these shorter courses, and the universities are not there yet, but we are moving that way.
We have a large number of courses that are linked to the important area of migration and health. And this was a strategic initiative from our Vice Chancellor. So this is an area where Uppsala want to contribute. We want to contribute for a better world, and this is a very important area for us. This spring we arranged a workshop focused on how to help refugees, how to help migrants in the health area. So we invited participants from Ministry of Law, Ministry of Justice, from a large number of countries. We met, we discussed, we developed guidelines, and we aim to continue work this way so we can contribute.
What I believe makes us unique is that we also host the WHO Collaborating Center on Refugee and Migrant Health data and evidence. This is quite unique because this is the only one in Sweden and the third currently globally. What this gives us is that within the Collaborating Center mandate, we are supporting WHO in several activities. So what we started was to develop actually a guidance on how to address health in immigration detention, and also how to improve the use of alternatives to detention. We also support WHO in providing technical assistance to specific countries. Publishing guidance is one thing, but we also need to help the member state to implement, to adapt the guidance to their context. The best way for us to do that was to create this workshop.
My collaboration in this course is to give the good example of how we build up our work through mental health in detention, just to tell how we build up and what we do, about the trainee that trains the staff later on. So we try to get the staff to know and understand people with health care issues.
The workshop itself was very useful and it was very interesting to hear the experience of colleagues from other countries, how they solve the problems of detention of foreigners. It was very interesting to hear experience about the detention impact on the health of individuals, and also the discussion itself of possible alternatives to detention.
The University of Uppsala gives a great opportunity because these courses are needed and it's not a lot of them. People that will work with asylum seekers, migration, or even detainees need to understand and know what they're going through. So this is a good way to prepare them for the future work they're going to do.
Colleagues, we just see the example of Sweden. So thank you so much to the colleagues on the faculty from the University of Uppsala, and especially pay attention that that's the WHO Collaborating Center on Migration and Health Data and Evidence in the European region. The head of that Collaborating Center, Mr. Sorej Jose Putamparambil, will join us later in the questions and answers. Sweden is an interesting example. As you heard, 20% of the population of Sweden is migrant or refugee population, and for different reasons. For labor, you said 20% Indian today in the automobile industry or IT, but others in the recent years due to the Ukraine recently as well have been an influence. But how this has been integrated in the university, especially in researches like with the detention centers, how to address and provide healthcare and rights to the migrant population. It's not only to produce data, but it's also to give guidance. It's how to translate that research into clinical day-to-day exercise. So we move along and we go to the keynote address. The keynote address is the crucial role for universities in promoting capacity building for the health of migrants and refugees. This will be addressed by Professor Alexandra Obach. She's the director and researcher at the Social Studies and Health Program at the Faculty of Medicine at la Universidad del Desarrollo in Chile. And we further ado, can we proceed with Professor Alexandra Obach, please?
Hello, my name is Alexandra Obach. I'm the Director and Senior Research at the Program of Social Studies in Health, PROESA, at the Institute of Science and Innovation in Medicine, which is part of the Faculty of Medicine at the Universidad del Desarrollo in Chile, South America. My presentation, entitled The Crucial Role of Universities in Promoting Capacity Building for the Health of Migrants and Refugees, seeks to discuss about the role of academy in the field of migration and health and in promoting human capacities and resources in this relevant and urgent field. As a starting point, what is our role as academics dedicated to conduct research in the topic of migration and health? Our first mission has to do with generating novel knowledge on migration and health, such as updating our diagnosis, meanings, and understanding in this matter through systematic and robust research that produce rich evidence around this dynamic and highly complex topic. Second, we should promote an effective transfer of the knowledge that we generate into real-life contexts at different levels, so that it has an impact on many different audiences like decision makers of public policies, health authorities, healthcare teams, communities, and the general population. In this way, we build bridges between existing theoretical knowledge and practical interventions and actions that promote the health and the well-being of the migrant population. Our third role has to do with being able, based on the evidence we generate and the translation experience that we have implemented in real life, to promote capacities and empowerment of migrant communities. This has a strong effect in the exercise of human rights, but also in their effective integration and participation in the health systems available at every host country. One pivotal aspect of the relationship between migrant communities and health systems has to do with developing capacity building within healthcare teams that provide care at every point of delivery. What have we done from Latin America, and specifically from our interdisciplinary research program at Universidad del Desarrollo, PROESA, to effectively develop these three roles? In Latin America, migratory flows have undergone drastic changes in recent decades. Historically, Latin American populations tended to migrate to countries located in the Northern Hemisphere, but given the transformation resulting from globalization and economic, political, and social changes, current flows in the region tend towards a so-called South-South migration pattern. This has meant that some countries in the region, like Colombia, Brazil, and Chile, have become important focus of destination from Latin American migrants, including Venezuelans, Haitians, Peruvians, and Bolivians. These recent migration flows have quickly and dramatically transformed the social and cultural reality of the region, as today around 7 million people have left Venezuela, along with other migration dynamics and changes. In addition, the region has received refugees from other regions of the world. In the case of Chile, for example, people coming from Afghanistan, Iran, and other similar countries have arrived in recent years. These communities face a series of challenges of social integration, given the existing cultural and linguistic distances from our country, which has triggered various acts of violence and xenophobia towards this migrant population in Chile and other Latin American countries. Universities have a crucial role in creating social and public awareness on the health of migrants from a human rights perspective. In this sense, and as an example of this, in 2015 we collaborated with the national television to produce a number of reportages that were displayed all over the country in the promotion of the rights and well-being of migrants' children in Chile. The academia dedicated to this topic in Latin America has focused on addressing the dynamic scenarios that have occurred in the region in relation to migration and their effects in population health. In this sense, research has been focused on characterizing the new migrant population, as well as revealing the social inequities that these populations suffer when they settle in the host countries and the consequences that this entails in terms of health over time. There are different academic groups and pieces of data that displays, from a social determinants of health approach, the structural components that place migrants in a position of both human and social vulnerability in our region. Also, existing barriers and obstacles that many migrants must face when seeking effective access to health care has also been significantly documented, especially among those in an undocumented migratory situation. The COVID pandemic has confronted researchers and universities from the region with new challenges. Similar to other countries, the closure of borders in Chile implied the inevitable massive entry of migrants through unauthorized crossing points in the north of the country, unleashing a large and unprecedented humanitarian crisis in the territory, with migrants crossing the Atacama Desert by foot, including pregnant women, children, and older adults. Most of them come from Venezuela, after a complex and risky transit that can take from some weeks by car up to 6 months by foot. In addition, we have observed a worrying increase of homeless migrants all over the country, including in many cases young children, and xenophobic acts led by the local population and settled migrants who demand the immediate expulsion of the fragile population. These are urgent and avoidable challenges related to the protection of the needs, rights and health of migrants community in the Latin American and Caribbean region. In this complex global and local context, universities have a central role, especially when it works connected with the state, international organism and the social society. Universities play a role in many areas of promotion, support and effective response to the health of migration and refugees. In our experience in Latin America and the Caribbean, and after over 15 years of research in this topic in different countries in the region, we fully understand the opportunity of universities to create knowledge, transfer new ideas into solutions, and test them in real life before they can be adapted and scaled up by governments and healthcare teams. We can also act like bridges between migrant communities and public authorities, promoting the inclusion of their voices in the decision-making process and high level. We can also translate evidence into training and capacity building through the creation of courses, diplomas and workshops that contributes to promote effective and culturally pertinent migration-aware healthcare systems. We believe universities should promote multilateral collaboration to catalyze the protection of the needs and rights of migrants and refugees all over the world. To this end, our team is part of many different professional and academic networks like the Lancet Migration Latin American Hub and the Andean Health and Migration Network SAMI. In 2020, we also created the Chilean Network on Research in Migration and Health, RETISAM, that promotes the dissemination and exchange of evidence-based knowledge related to the health of migrants and refugees in the country, via open seminars, bulletins, and workshops. The first National Open School of RETISAM took place in May this year and was undertaken by over 300 people. In 2021, we further supported PAHO in the development of an evidence-based dashboard that allows access to healthcare teams, academics and decision makers of available research that is produced on migration and health in the Americas. In the same line, we have also contributed with the World Health Organization in the synthesis of evidence that has been produced in the Americas in relation to migration and health for the first world report in this topic. Since the beginning of research on migration and health, one of the topics to be addressed in Latin American universities has been the identification of barriers to access as well as the treatment received by migrants in healthcare. There is a large amount of evidence reporting discrimination and xenophobia by health personnel towards migrants. This is linked to the cultural differences that exist in relation to the perception of disease and care. For example, there might be different understandings on what it means for each migrant community, as well as other cultural diverse groups like Aboriginal tribes, to be healthy, as well as differences in parenting patterns, culinary culture, among other dimensions of health and well-being. These aspects might be ignored or poorly understood by healthcare teams, often lacking the necessary tools to deal within a culturally sensible way. For this reason, a relevant amount of academic work in Chile and the region has been dedicated a great effort to transferring specific and detailed knowledge in this matter to health teams. For example, in our experience, we have trained the Ministry of Health back in 2016, as well as health providers in many regions in the country in relation to the health of migrants and refugees over the past 10 years, incorporating the essential approaches of interculturality, human rights, gender and participation, among others. The main objective is to install capacities in the health teams so that they can provide intercultural health care with greater equity, justice and effective treatment. Along with this, we also carry out different workshops with migrant communities, with the aim of empowering them in relation to their health rights and giving them tools to increase their health literacy, so they can navigate the health system more fluidly. Likewise, we develop material such as practical guidelines for migrant communities to support processes such as parenting and well-being in the context of a migrant family experiencing social vulnerability. In terms of trying to transform the reality of many migrants during and after the COVID pandemic, we have gone a step further in the translation of knowledge and have created the PIAM program, an online free-charge counseling program for migrants in Chile. This program provides direct counseling and care to migrants in the area of general health, mental health, legal support, and social assistance. It has been created from a collaboration between the university and the private sector in order to promote social integration of those who remain undocumented in the country. What is sought with this program is that, as academics, we can closer to the reality of migrants, we get involved in the community in solving problems, and we also empower migrants' unique resources and capacities. This is not only to achieve an emergency reception of the migrant communities in Chile, but also to facilitate the structural adaptation and integration to the country. We believe that this is also part of the role that universities must play in the field of health and migration, transform reality based in knowledge. Thank you for your time and attention, and I wish you a wonderful third global school. Goodbye.
Thank you so much, Professor Alexandra Bach. And you can see is how the University of Desarrollo in Chile have addressed a three-pronged approach the issue here. As you know, migration continue to be increased and more numbers, and there has been in more frequent in recent years and increases discrimination against refugees and migrants. And when you look at the approach of PROESA, there was not only addressing general public by educating the general public about facts of the migrants, the health, but as well they tackle the medical cadre, the Ministry of Health, and lastly, but not least, they also address the refugees per se, how to access services, how the system works. So they have a three-pronged approach in addressing a human rights approach, in really welcoming the refugees and integrating them and part of the health system and structures. As time is running a bit, and we'll continue moving along. And the last presentation comes from our colleagues in the WHO Embro region, and is from the Lebanon.
The Eastern Mediterranean region is featured by forced displacement, caused mainly by violent conflicts and natural disasters. There are about 13 million refugees and internally displaced persons across the region. The region also hosts a sizable population of migrant workers, about 47 million that live mainly in GCC countries. The forcibly displaced populations, including refugees, IDPs, and returnees, are vulnerable to poor health conditions due to the circumstances they live in. Moreover, as many remain marginalized, they lack access to affordable and quality health services. Even though health of refugees and migrants is a major concern in the Eastern Mediterranean region, the technical capacities to tackle existing problems are not always adequate in national health systems and health partners.
We, the Global Health Institute at the American University of Beirut, follow our mother institution's path in supporting and addressing the challenges of our region. In that sense, it was a pleasure to partner with WHO EMRO to offer the course on refugee and migrant health. This is an issue that is very dear to our heart because 1/4 to 1/3 of the refugee population in the world reside or originates from our region.
With this being said, a needs assessment was carried out with experts from WHO EMRO and AUB-GHI to identify key gaps in the region and conceptualize, develop, and implement a modular training course on refugees and migrant health in EMR.
The course served as a 10-session training addressing everything from the health implications of migration and displacement, international governance and frameworks on health of refugees and migrants, the political economy and social determinants of migration health, to financing healthcare for migrants and refugees and integrating them into national health systems. The training course also explores the provision of quality healthcare services throughout migration rights during crises, health promotion and protection, the means for integrating migrants and refugees into health research, and providing for contextual experiences from the field during COVID-19 realities. Accordingly, session briefs and learning objectives were mapped out where a recommended list of experts and panelists developed the course content by cross-validating it with subject matter experts who provided their technical knowledge and experience.
For each session, the content expert was identified based on their academic and professional experience. Each expert was then involved in the process of outlining course objectives, content, and selecting panelists for each session. 33 experts were selected from different backgrounds, including academicians and health professionals working in WHO or similar international organizations, who have extensive experience working among migrants and displaced populations to fulfill the aim of a comprehensive approach.
The course was implemented in collaboration with key partners, including IOM, UNHCR, and UNRWA.
This course is a unique platform for bringing colleagues and experts from national health systems, UN agencies, academia, and civil societies to meet and share the up-to-date knowledge and evidence-informed practices that are required for mainstreaming refugees and migrants into health policies, strategies, and plans.
Participants were selected based on geographic location and area of expertise, while ensuring the selection of participants from across different agencies. 22% from Ministries of Health, 22% working with WHO, 14% from other UN agencies, 17% working with international NGOs, 12% from academic institutes, and 12% of the participants were selected from other different institutes.
Because of the evident need for such a training in the region, the demand for the training was very high, which was a bit challenging when we were selecting the participants or attendees. In fact, we received over 780 applicants over the 3 courses, whereby a total of 250 were accepted to ensure the delivery of a convenient and good quality training.
This collaboration between an academic institute like AUB-GHI and the WHO EMRO creates a great opportunity to reach staff at the level of health ministries in the region and the humanitarian organizations, while ensuring the delivery of a well-developed academic course to address the needs of the frontline healthcare.
Upon completion of the training, the evaluation forms completed by all participants were considered and analyzed. Around 97% of the participants found that the objectives of all sessions were clearly defined and the content was well organized, while confirming that the topics covered during the training were relevant and useful to their field of expertise.
The course was really informative since most of the sensitive and crucial topics that related to refugee and migrant have been covering during the course. Without any doubt, the course also touched upon the most difficult challenge that face international organizations and its possible solution.
This course is a great opportunity to learn and share knowledge will be provided by the proper tools to see migration and forced movement as a reality to be managed rather than a challenge to be solved.
To ensure the sustainability of this initiative, we have established a technical group that is co-led by both WHO and AUB. This group is responsible for joint planning, implementation, and evaluation of the course over time.
This is imperative for achieving universal health coverage and health security, while ensuring no one is left behind.
It was a systematic response to the needs of policymakers and practitioners in our region for evidence-informed interventions that are required for advancement of universal health coverage, as well as preparing for and responding to emergencies in the context of refugees, migrants, IDPs, and other displaced persons.
We look forward to advancing this partnership beyond this project to better serve in alleviating the suffering of refugees in our region, especially when it comes to health issues.
Colleagues, that's the last sample that we have, the last case study. As you see, this is from the EMRO region from Lebanon. The EMRO region of WHO at the moment is one of the largest. It's 1/3 of the population is in the EMRO region in the world, including 47 million migrants in this Eastern Mediterranean region. The training that you saw presented in this, I had the opportunity to participate in this training a year ago in February. So I personally recommend it, but as you see anyway, is how a university can definitely mark the result and support migration health and how to educate colleagues and health workers in better addressing the migrant population healthcare. I will pass to Severino.
Santino. Thank you very much. Well, personally, I'm extremely pleased about this sharing from EMRO region and American University of Beirut, because after a number of years we are running the global school, this is the type of regional training development we like to see accompany the global school. We really look at EMRO region kind of setting a standard, setting an example that we hope can inspire also other regions. I have to say also in Afro, I saw these days connected and posing question Ursula Trammer, who is behind courses also in the Afro region together with the University of Makerere. So extremely pleased to see this initiative starting at the regional level. We need to help them, we need to support them, and to continue to invest into local training aiming at strengthening understanding and knowledge on health and migration on regional and local context. Thank you very much.
Thank you, Santino. We'll pass to the question Q&A, but before that, just to introduce, we will have in line 4 colleagues. Professor Alessandra Bach will joining us, as well Mr. Sorecho Jose Putamparambil from the WHO Collaborative Center in Uppsala University, Dr. Ali Aldan, as the last presentation that you saw, and as well Ms. Miriam Orkut, the Technical Officer on the Research Agenda, Health and Migration Program from WHO HQ. I will pass this to Jason and Michael for Q&A session.
Thank you very much, Dr. Jorge. So welcome again to the Q&A section. I'm going to be taking questions from the internet and from the floor here today. We've got lots and lots of expertise in the room and online, so please feel free to raise your hands, get involved in the discussion. We'd love to hear from all of you. Thank you very much. So the first question is from Antonio, and it goes to Alexandra. Are there any inter-university collaborations happening on refugee and migrant health that you're aware of at the moment?
Well, first of all, I would like to say hi to everybody, and thanks for the invitation for being here today. Well, there are a lot of collaboration between different universities that it's happening around the world, and in our region and Latin America, we have, as we show in the video, different networks that what we are trying to do is to establish capacity building through different universities to see the migration issue in the region as a whole, not something that is happening just in one country and that has to do with that context, but with a vision or a focus on a regional problem. So this has to do with a global health focus, but also with other focus that had to do with more specifically context of Latin America that has to do with social medicine, and also trying to detect what are the structural vulnerabilities that affect all of our countries in the region of Latin America and the Caribbean, so we can find or try to find solutions that are shared, that give us solution to problems that are shared by all the context of the countries of Latin America. And in that sense, we have different networks of Andean countries, but also furthermore with countries that not only share frontiers, but also that share cultures, and also trying to understand what is happening in other contexts like Haiti or other countries that are a little bit further or more distance in a cultural perspective.
Thank you very much. Santino, you said like to jump in on this as well?
Yes, thank you. Indeed, the reply to this question is yes, there are plenty of networks. Many of them are hybrid, if I can say like that, of academic institutions, international organizations, NGOs, civil societies. There is a network of academic institutions was mentioned during the Chile video supported by the Lancet, which is a derivation of the Lancet Commission on Migration. WHO has a network of more than over 800 collaborating centers, academic institutions. And specifically to the program on health and migration, we are setting up a global network of academic institutions based on regional capacity or regional entities to support the research agenda. But Miriam is connected. I'm sure she will add more about. Thank you.
I think this might be a nice opportunity for people to add a little bit about the collaborations they have going on. So Suraj, Miriam's gone, but Suraj, if you'd like to jump in on this talk.
Yes, thanks a lot for the opportunity. Yes, we do have inter-university collaborations, but I would also like to emphasize, just like Dr. Santino Severoni mentioned, it's also important to collaborate with civil societies and also government actors. For example, one of the things we highlighted in our video was how we collaborate with the Swedish agencies, but also with how we involve other universities in teaching and sharing expertise. Recently, we had a meeting of collaborating centers and other main academic partners within the European region, like last week, and how to integrate and work more together. So there is a high tempo of activities going on, and it's mostly focused on, while generating evidence, how to translate that into practice. For specific details, definitely anybody interested can contact me or Miriam for that matter.
Fantastic. Thanks very much. Any other comments at all? We have Miriam back as well. Okay, I'll move on to the next question. This goes out to the chairs, so Santino and Dr. Jorge. It's from Daniela Ramaj. Do you think that medical courses should be mandatory for all workers in the migration camps? Is there a strategy for that? Medical courses should be mandatory for all workers in the migration camps. So I think this is extended to all levels of the migration and refugee responses.
I'm not sure what the terminology in medical courses sounds a bit broad, to be honest with you.
I think the question seems to be getting at issues of things like first aid, for example, and perhaps emergency response, disaster response, health-related disaster responses.
Well, in that regard, if we're talking about for emergency per se as a response, at the moment, of course, I mean, when we try to involve community, I can use the example of Bangladesh as we speak. Being here in Bangladesh, we have created, and I mentioned a couple of days ago, a skills lab with the main intention, yes, is to educate the cadre, the healthcare workers, but we have colleagues like the Red Crescent Society as well that do have first aid courses, which include the community of the refugee migrant population, in which they are the first line responders. In emergency, they are. This is what we're talking about. I'm not sure we can cover all of them, but it should be some key focal points that we can address that.
And is that project, is that in collaboration with an academic institution?
At the moment, the one that we are using is using colleagues like the Red Cross Society, but as well, we are using the Medical College, which is an institution based in Cox's Bazar, in which we do train the healthcare workforce.
Fantastic. Would anyone else like to jump in on that question? Okay. Sorry. Please go ahead.
If I understood properly the question, yes, even here, the short answer is yes. There is plenty of existing material to support capacity building, training, technical guidance, standard operating procedures for emergency and non-emergency context. And all those materials, I'm referring particularly to our WHO material, are always produced with excellency institutions in terms of specific technical competence on the subject which are focusing on. So academic institution or recognized international expert collaborating to that. Thank you.
Fantastic. Thank you very much. This is a question from to Miriam, and it comes from Isato. It's quite a technical question, so please bear with me. Are there plans for incorporating policies as part of global reforms for the assessment of potential serious cross-border health threats for the collation of necessary intelligence pinpoints? So that's quite a mouthful, but I think it's talking about plans for incorporating broader policies and specifically the influence of academic institutions for cross-border health threats. So that's quite a challenging topic.
Thank you so much. And I think that, this actually goes back to probably I'll address a little bit more broadly, and then I'd hand over to colleagues, including some of my colleagues within WHO. But in terms of the need for dialogue and engagement and collaboration across borders, I think this is a very key point. Not only, this probably links also with the comment around networks as well, not only for enabling academic institutions to share data, to have common SOPs or common emergency preparedness plans, but also in terms of actually facilitating responses of health systems, which are not just limited to a certain country and national borders, but also are able to respond to the needs of individuals who are mobile across borders. So I think that is one point. And the other thing I think which is key is around effective linkage between policy practice and academia. I think this has come up very clearly in the presentations today, but there is very often this a lot of excellent work going on in each of those sectors, but actually creating that dialogue whereby academics and academic institutions can be an essential part of all different aspects of response, as well as having that dialogue from policy and practice back to academic institutions. And this was where Santino also mentioned that, there is a key role for WHO as well to act as a convener and to be able to help to facilitate that collaboration and dialogue between policy, research and practice in a more systematic way across all regions. I think the question actually is very specifically also along operational response and not just implementation research. So I'm also going to hand over to colleagues for any further response. Thank you.
Fantastic. I think we have a comment from the floor very quickly. Yep.
Thank you. Rather than a question, is really a comment. I find particularly interesting the experience from the University of Desarrollo in Chile, in Santiago de Chile. Overall, the aspect of engagement in some social mobilization campaign. I think that this is pretty important, just to move from the old idea of a university as a sort of ivory castle, completely detached by the reality. And in this regard, regarding specific activities for fighting stigma and discrimination, my comment is that if it's true that there is stigma and discrimination against the migrants community, on the other hand, it's also true, and so several articles on this, that there are stigma and discrimination also on health workers coming from the migrant community with different color, with different aspect and different culture. This was my comment. So just to address also this component of what is a problematic component, of course, of stigma and discrimination, not only against migrants, but also against health workers that are migrants. Thank you.
Fantastic points. Thank you so much. Oh, we have another comment from the floor. Please pass it over.
Thank you. So, colleagues, actually, I wanted to share my personal experience when we had been working on creating a country profile for the migrants' health. And ironically, actually, we observed that we had to go through many articles, and hardly few articles had information about the health. So there are many articles about migrants, but there were no or very few, like cholera in FDM, and similarly, like this type of sporadic or scattered information was there. But as a health, like complete health indicators and assessment of these indicators, this sort of complete assessment, we didn't find any to refer for this country profile. So so actually I felt like somehow the people in the academia who are behind this research, they are not much influenced, or there are some laggings that we can overcome to advocate to them so that they include these health aspects to their research. And on the other hand, the health workers and the research institutions in the country, those who are already do their research on health, we need to advocate to them so that they can focus on the migrants. Similarly, this way we can make a network or coordinate the whole thing. Thank you.
Thank you very much. The importance of networks coming up again, very, very important. So thank you. This next question is for Ali, and it comes from Davud Pomazi, who joined us yesterday. He says, firstly, thank you very much for the wonderful presentation. He's interested in the method of delivery of the courses that you're teaching and the methods of teaching themselves. And also whether you have any evaluation tools, specific evaluation tools and frameworks that you might be using to measure the impact of the courses.
Well, thank you so much. I appreciate and congratulations to Dr. Santino, Sierra colleagues for the successful actually implementation of third global school. In terms of the question, basically we started this course in collaboration with GHI at American University of Beirut during the COVID time. So basically the course was started as an online course, and based on the needs assessment we had a region and partially was presented in that video, we came up actually with 10 main sessions that we jointly with AUB and our colleagues from WHO Euro and AFRO prepared and presented. We hope that we can organize the fourth course in person in coming year. And there is a website that I just shared with colleagues that can kindly announce to the participants and the interested colleagues to follow up with the announcement. In terms of the evaluation, AUB colleagues developed a tool and followed up with the participants. The main basically question was actually the impact of the educational materials and then participation in the course on their work implementation and real life. In general, was the result was very satisfying. However, this type of the course never replace the on-job training that I think we should go toward that direction. We can teach theories, we can teach good present good examples, etc. But at the same time, we need to think of the type of the courses that support the actual implementers from the different agencies on the ground. So if there is any information needed, I would be pleased to provide. Over to you.
Fantastic. Thank you so much, Ali. We're getting a lot of interest in these specific methods and models for delivering training. So I'm wondering whether we can broaden the conversation as well. Alexandra or Suraj, would you like to jump in on that? Whether you have any interesting methods for delivering teaching or approaches to teaching that you'd like to share?
Alexandra, if you want to take the floor first, please.
Thank you very much, Suraj. Well, that is a very good question, and it's not an easy question to answer because it has to do with the audience that you are giving the courses. First of all, when we train or when we try to build capacities in the health sector, it's we have learned that it's very necessary, first of all, to listen what is happening in the culture of the health sector. What Pino was saying before about stigma and discrimination is not only about migrants and the national population. It has to do with some basic cultural constructions in society. So we have to go there with, for example, health workers and trying to understand how are they, from their point of view, incorporating migrant population into the health system. And this has to do also with incorporation of colleagues as health staff in their cultural work as teams. So in this aspect, we have to try to foster some methodologies that are not only like academic methodologies, but also that has to do with linking with the person and the audience that we're trying to sensibilize in the migrant and health issue. So if we just say that what they are not only thinking but feeling is bad, we're not going to be able to get into the message that we're trying to do, because our final message, especially for the health system sector, is for building capacities of intercultural health teams, especially in the primary attention of health. And for this, we have to do like a cultural reconstruction of the institution of health. When we are working with migrant communities, the methodologies have to be different, because what we have to do, especially as a colleague was saying in some of the videos, trying to empathize with what they have been through, and trying to be the most open in incorporating the suffering that they have been through, not only through the migration process, but also of what they are dealing with in the trying to build a life in the country of a reception country. In this case, what we have to do with the Chilean situation. So there are very different methodologies that we can use, but it has to do especially with the audience that we're dealing with, and trying to be creative about the complex and dynamic context that migration has face us as academics, and also with the transferring of all of these issues into different sectors, the health sector, the migration communities, and also with students of undergraduate and postgraduate programs.
Thank you so much. It's very important to remember that sensitivity to the audiences we're dealing with. So thank you very much. Suraj, would you like to jump in on that at all?
Yes, please. Thank you. I think the question was on a particular methodology on how we deliver the courses, but I think it's also a bit more than that, because for any course we are trying to give, we are actually aiming to have an impact depending on what is the impact you want to achieve based on the course. So this has to be thought before. And as Spina was mentioning, sometimes universities are perceived to be sitting on their ivory tower. So just to have the ground reality connection. For example, we have courses at bachelor's level, master's level, then we have targeted training workshops on specific topics. All these have different kinds of approaches. The bachelor's and master's would be a typical university course. Then the other course highlighted in the video was mainly targeted working people. So what we did was that we had it as an evening course, we had it as an online course, and we also had as a reduced speed of teaching. So 100%, we reduced that to 25%, which means they only need to spend around 8 to 10 hours per week. That, at least to that particular audience, was a helpful way of doing it, because they didn't have to travel a lot, and Sweden is a long country, and it wasn't feasible to have it in campus. Whereas the other workshop, say on detention, for example, this was based on country request. And there are also specific examples where we start with the country assessment, we see what are the needs there, we have a discussion engagement with them, and then we try to develop a course for them per se. But then the workshop we had here was more on, we give practical assessment tools. We give that to them prior to the course, they work with it, nothing big, but small assignments and questionnaires. They come back, we discuss in the bigger group where we have experts to support them and provide suggestions, which they then have to take back to their countries and see how to adapt to that particular context. So depending on the impact we are trying to achieve, and Alexandra mentioned, depending on the group we are working with, we approach different methodologies for various courses. Thank you.
Fantastic, just building on exactly what Alexandra was saying. And can I ask the same question to Miriam as well? Would you like to jump in on teaching methods and delivery methods?
I think actually, if it's all right, I just wanted to focus more on the the sort of network and linkage, I think it goes through all aspects. So from teaching and training courses through to research and implementation. I think, academic institutions do have a very unique role to play, not just in developing these courses and teaching modules for their institutions, but I think something that's come up very strongly, and it's certainly from the health and migration program, something that we are also working on, is how do we create the linkages between these existing excellent teaching programs or modules, master's courses, so that we can actually make sure that not only is there good linkage between institutions within regions, but also the linkage and dialogue between interregional at a global level. Because I think something that we've very clearly seen from WHO headquarters is that there is, of course, a lot of learning that can be done between the regions, although acknowledging that the context and the migration realities are, of course, very specific often to particular countries, or even within countries to particular regions. What can also be seen are some commonalities and some areas for exchange of best practice. And of course, that is something that we are very much moving forward with, not only with the global research agenda formation over the next 3 months, which will help, as Santino has mentioned, to form a platform, a global platform, which we can then use hopefully as inspiration at regional and country level, but also the formation over the next months of a global research network. So I think that these discussions are extremely valuable, and we're very much looking forward to helping to consolidate those very valuable experiences of training programs and also of research in different regions and migration contexts. Thank you.
Thanks so much, Miriam. We've got some fantastic questions and responses today, so really keep it coming. Thank you so much. This question goes out to everybody, and I think it would be really interesting to hear from the floor as well, if possible, on this one. How is it possible to make sure that before we actually start teaching, that the material and the courses that we're teaching are actually doing their jobs to further good health outcomes, and specifically equitable and equal health outcomes? How can we make sure they're going to do that before we start the teaching? So maybe we start with Ali on that question, if that's okay.
So basically, I think the point is that the way that we do our needs assessment and also develop the material, that should follow a very strong participatory approach. Basically, most of the time, what we do, as my basically life as academician, we basically have our own style of the curriculum development based on whatever is available on the literature and etc., our own experience and interest. That absolutely is correct. But however, I also learned that it would be great that basically whatever material we develop would be jointly with all the relevant stakeholders and the target audience finally we want. The course of the refugees and migrants should be, the curriculum and content developed jointly with the policymakers, with the managers, with the implementers, and the refugees, migrants themselves. So that I think would help to make sure whatever we teach will reach to the last mile and hopefully can make impact. Over to you.
Fantastic. Thank you so much. Are there any country office colleagues here that would like to input on how we can make sure our trainings are effective before we start teaching, and how we're making sure we have equitable and equal health outcomes? Yep, just over here. Thanks very much. And any emphasis you can place on the role of academic institutions as well would be really, really helpful to us.
So actually, this is a question. I'm working with MSF. So we are treating most of the FDMN population here in Bangladesh. And also we are doing some operational research. So my question is there any option or opportunity to integrate the operational research findings through this platform or with the academia.
Okay, I'd like to hand over to Miriam for that question.
Thank you so much. So absolutely, I mean, in terms of the knowledge sharing through both the research network, which is being set up at the moment, but also through the research agenda process, the intention is actually to have that engagement with all stakeholders, so from civil society and NGOs, as well as through to UN agencies and interregional mechanisms, as well as through to colleagues in academia and our regional colleagues, very importantly. And this, I think, is where what we have seen from the program is that there is, of course, a huge body of academic literature on migration and health, but actually what is often very much lacking is the implementation research, the operational research, not only the research itself, but sometimes the translation of that. So as you've mentioned, you know, many NGOs and humanitarian organizations will conduct operational research, but there isn't always that translation. And there's often not the translation from academia or policy also into those back into NGOs. So I think one of the intentions that we have through the network and through the research agenda is actually to try to help to bridge that gap and to make sure that we can have mechanisms for discussion and for collaboration that can be set up in order to strengthen in general the field of migration and health research, but also the key here being to strengthen the translation of that knowledge into policy and practice, and to make sure that policy and practice can be involved in defining research agenda questions as well. And I think policy and practice also including the communities who we are working with as well as key. Thank you.
Thank you so much, Miriam. This is kind of a follow-on question. I'd like to pitch it to Suraj and Alexandra. It comes from Maya at the American University of Beirut. And they're asking, are the views of refugees and migrants taken into consideration when we're actually planning courses and trainings on health responses? And we can also extend that to the planning of policies as well, as Miriam was talking about. So yeah, to Suraj and Alexandra, please take it away for us.
Sure, I could start. Yes, we try to our best to take the voice of refugees and migrants into planning of the courses. And again, it depends on what kind of course and what kind of topic you're discussing. There are several ways we try to do it. One is actually invite them to be part of the teaching faculty. I mean, sharing their experience, and because we also have to see any issues, and especially migration health, from different perspectives, from the healthcare provider, from the policy planner, from the beneficiary or the refugees and migrants. So we try to incorporate them in our teachings and how they can share their voice and ideas. But also connected to one of the previous questions asked, how do you measure the impact? You know, it has to be based on a need, and the need can come from the refugee and migrant community. It can come from the healthcare providers. And how do you assess that? For example, if you're planning to develop a new course, often we have workshops where we invite various stakeholders, including refugees and migrants, or like, what are their points of view? It could be completely like a blank slate. We have this course. How would we like to define that? Or we have this initial idea. What do you think about it? So there are various ways we try to incorporate their ideas in the course and in the curriculum, and also in research we try to do, because it has to be participatory. It has to be co-production. And that is sort of the way we look at research and also teaching. Thank you.
I'd like to hand over to Santina as well. He's got some comments for us.
Just to complement to the question of Maya, yes, indeed, it's extremely important, and I would say almost regularly involve refugees and migrants into the different actions, at least from what we concerned. This is extremely important, not only to bring up a different point of view, but also to really integrate, to really put at the center also the experience, the knowledge, and the capacity that might be extracted and provided and shared by such colleagues. For example, even our team, my team in Geneva, we have staff recruited among refugees. And this is extremely important. Regarding the research, well, Miriam can say much more, but we really systematize that with planned consultations with institutions which are also representing migrants and refugees. The policy formulation become a little bit more complicated because depends the group in charge of developing the policies, but also at the government level, we see this more and more paid attention with inclusion of a migrant representative or refugees representative at least in the consultation, during a consultative process for policy formulation. Remain a bit of a challenge to identify the degree of representativeness of those called to participate, because there are groups organized, there are groups which are able to emerge and to be visible and play an important advocacy and leadership role, but not necessarily this structure group is able to represent the complexity or the full variety and the full size of the refugees or migrant population. Thank you.
Fantastic. I'd just like to pass that on to Alexandra before we hear from Miriam. So Alexandra, would you like to chime in?
Thank you very much. Yes, I agree with all the points that Soret and Santino has pointed out. And well, what we do actually is try to get involved the migrant communities and their point of view of the experience, because what we are talking about and we're trying to sensibilize is about the experience of the other. So it's very important to be aware of not be ethnocentric in this matter. So for that, we're not only for teaching all these training programs, trying to incorporate the migrants community, but we have also migrant persons in our groups, in our research group, in our teams, and we are always trying to get linked with migrant agrupations. And as Santino said, not only with the traditional migrant aggregation, but also, as this is a dynamic and complex problem, with all the agrupations that are emerging because of the different scenarios that we have, for example, in Chile. Nowadays, trying just to make a point on this last issue, we are facing different violences, gender violences, in the north of Chile because of this humanitarian crisis we have in the border points. And we are, for us, it's very necessary to get involved. For example, the views and the point of views of women, children also, adolescents, young people, and LGBT communities, because they usually get to be the more invisibilized communities. So it's very important to get these communities involved in all aspects of research, and also as a part of these training programs, as teaching in the teaching part and also in the thinking of all these programs. But it's very important to not left anyone behind and not let any of their experiences behind. So it's very important to be aware of trying to keep all these new actors that are very relevant in the migrant situations to get involved in everyday life of this issue of the academic work that we do in research, but also in training programs, diplomas, and all what we do for keep the community in updating in the issue of health and migration.
Wonderful. Thank you so much. This issue of beneficiary engagement is a very important one. So I'd love to hear from Miriam and then Ali as well. If you could give your opinions, that would be fantastic. Thank you.
Thank you so much. I'll just very briefly add to what Santino already mentioned in terms of the inclusion of refugees and migrants within the process of the research agenda and research network formation. We actually had some open calls over the last month, which specifically for civil society engagement, we were highlighting that we very much encouraged civil society and NGOs to apply who had migrants and refugees either represented within their organization or who had founded it, so that we will actually have many of those voices within the technical consultation process over the next few months to determine research priorities globally. But another thing which we have been working with one of the WHO collaborating centers on migration and health at the University of Limerick on is how might we be able to also continue in a very participatory manner, but also ethical manner to engage with civil society and with migrants and refugees moving forward into research implementation, but also just making sure that we have a continued inclusion of those voices. And I think it's already been raised that this is, of course, very important, but also challenging because it is necessary to try to ensure that voices are there from all different migration and research and refugee voices. So, for example, thinking of, having a representation not just from those who might be refugees or asylum seekers, but also those who might be within transit context, or who might actually have, a different experience of migration and health impacts. So I think this is something that we are certainly working on and have already started to do, but we will continue to work on it from a migration and health program perspective. Thank you.
Thank you so much. I'd love to hear from Ali, but we're extremely short on time. It's just gone past. So I'd like to quickly ask everyone, is the University of Uppsala and the American University of Beirut already working together? And if so, what's the nature of that collaboration? And if not, are there areas that you could be collaborating on in the future?
So this is a question for me or Suraj? I think Suraj is best positioned to answer. Okay. I'm not based in the AUB University and the WHO. So basically, I'm not sure if that collaboration exists, but it would be great if not. But maybe Suraj can make a comment on that. What we need is this type of the inter-regional collaboration. Last week, that was actually a meeting on WHO Collaborative Center on Migration Health, organized by WHO Europe. And I'm sure many colleagues attended, and also our collaborators from the AUB. And this was actually one of the conclusions of that meeting, to basically expand and even formalize this type of the inter-regional collaboration. I think I hand over to Suraj. Over to you.
Thank you, Ali. Just briefly, yes, we did collaborate. For example, when coming to the production of the global report, we collaborated with AUB for that matter, and also with colleagues from Chile and other parts. But as Ali was mentioning, we would like to further our collaboration. And last week, we were meeting colleagues from AUB, and the discussion was exactly what we're discussing now. Collaboration in terms of training and education, but also in terms of research and support. So more concrete actions are to be expected. Right now, there is limited, but there is more to be expected in this field.
Thank you very much, Suraj. People are big fans of their universities. I think someone's asking if the University of Chile is also collaborating. Can you answer if that's the case?
Then one.
Nobody?
Yes.
Fantastic. Whether the University of Chile is also collaborating with international partners?
Yes, we're also interested in collaborate with international partners, and we collaborate in research, but what has to do with training programs, we also collaborate because it's very important not to get only with your local context, but also to try to reinforce our training programs, but also our research with our experience of other parts of the world and other parts of Latin America and the Caribbean. And we have cooperated with the WHO in different aspects, trying to get into the importance of being part of these networks and put the problems of the Americas and in Latin America in particular in the global context and in the global networks also.
Okay, thank you very much for that. I'm afraid we've run out of time, guys, so I'll pass it back over to Santino for some closing remarks and Dr. Jorge as well. Thanks.
Well, colleagues, I think time is up. We are a few minutes after the 5:30 time. I want to thank you all the panelists that join us virtually, Dr. Alessandra Baj, to Mr. Sorejo Jose Putambaril, to Dr. Ali, greetings as well, and Dr. Miriam Olkut as well. Thank you to all of you to participating here together with us today. And to closure and introduction to tomorrow's, I pass back to Dr. Santino.
Thank you, Jorge. Thank you so much. Thank you, everybody. Thank you for stimulating the discussion of today. Thank you, James, for distilling some of the most spicy, interesting questions. Yes, probably the best way to conclude today to say we are massively investing into creating the platform to facilitate interregional, global, international collaborations among academic institutions. We alluded several times during the Q&A to the upcoming academic network associated with a global research agenda. As I said, there is already an existing network of over 800 WHO collaborating centers, means academic institutions, officially nominated by WHO collaborating centers. And we are integrating this number with expertise on health and migration, which is a new topic. We also are very careful looking to a peculiarity we are observing in the collaboration of academic institutions and research, ongoing research on health and migration. That majority of the ongoing research is nowadays conducted by academic institutions. There is nothing bad in that, in high-income countries. Speaking about reality very often of low, middle-income countries related to the migratory process. Well, this is fine. We are very grateful. Most of them are our partner, but we are not satisfied. That's not enough for us. We want to really invest to even or to fill this gap by identifying in all 6 WHO regions also academic institutions from low-income settings, those settings where migrants are often departing from or refugees are generated from, and to team up them with academic institutions in other contexts. It is through the network we are establishing for a simple reason to really play also, again, this was alluded in the number of questions and reply to the capacity building process that we are trying to address those days. I'm concluding here, just sharing with you some issue of pride of this week, ongoing week, because today we are closing the 4th day. So we are going very fast to the closure of the school year in Bangladesh, where hospitality is just overwhelming. The participation, again, yesterday we had participants from under 32 countries. So I'm extremely pleased to see that really there is a representation from all WHO region. And Seattle is leading. Now I want to start a bit of competitions between the region. Seattle is leading with a 10 out of 11 countries representative attending the school. I want to recall to everybody that the video are original video produced specifically for the school. Thank you to all the colleagues that participated and contributed to the video. Will be made available and we are also planning to give further visibility and use of those videos. Thank you for responding to the evaluations. we see a growing number of evaluations on the school overall and the daily evaluation. This is very important. Sorry if I'm sounding repeating, but we really value your input, your feedback, because they're helping us to refine and shape up the school for the years to come. And I hope it's going to be a lot of evaluation comments in relation to establishing regional courses, collaborating with the global school, because we're really looking into that. Tomorrow, we're going to conclude with a different format. We don't have video to share. We will have a very interesting panel. We have exciting colleagues from IOM, UNHCR, the UN Foundation, and the UN Network on Migration. Again, we have a high-level interventions of the day, and the focus will be on capacity building for developing, establishing the competencies to promote inter-country, inter-regional collaboration and cooperation. This is a very important subject. We hope to have a lively discussion tomorrow after the panel. So I'm calling the day. Thank you very much again to those here in presence and all of you in remote. Thank you very much.
Thank you. Bye-bye.